You just did a version of this. High oblique sit.
That was totally good.
He's about to do what you just did. Oh no, it'll come later.
So cute.
So ipsilateral pattern. So a little, not a delay, but he should have turned to his left, but he's going to turn to his right here. Because what he wants is actually to his left. See the intra-abdominal pressure?
Dad, stop filming me.
Now, you just did this, but your hands were up off the, it's kind of a modified position, but you literally just did this a second ago when you were doing that, coming backwards. This is real similar to the one where you were on your elbows. Tripod. You just did this one. High kneeling.
It's so interesting for him.
This is called cruising or lateral walking.
He's going to make all his own decisions.
So before the baby walks, they'll usually laterally walk on furniture. Squat. Versus this would be 4.5 months. So this is like 3-month model that we actually started all our exercises from yesterday. See how the baby can effortlessly hold their hips in that flex position, whereas us, we're real compromised to do that because we don't have perfect synergy between all the muscles like they do. If you come to an A course or a pediatric course, you'll learn all the Voita test. Colley's horizontal suspension. Six-month. We know he's at least 5 months old because he can touch his genitals. what allows him to turn? Intra-abdominal pressure and the anterior oblique sling. So basically, what initiates the turn, if he's going to turn to his right there, would be just like we were talking about in the throwing athlete. So you'd have down by his ASIS here, we're going to have the internal oblique on his left side. This is going to blend into the abdominal fascia, rectus abdominis, external oblique on the other side, pectoralis major. So this muscle sling is going to pull toward this support, and that's what's going to initiate the turn. And then we have another anterior oblique sling here that's going to also be initiated after that, where we're going to be taking this shoulder to the new point of support, which is going to be the hip joint. And it's this muscle sling that allows the baby to turn. And it's the same muscle sling that allows us to walk. It's the same muscle sling that allows us to throw implements, whatever it might be. So it all will come back to developmental kinesiology in the end. Traction test. All right, so that is all we got.